My name is Nurse John. I've been a nurse for 4 years. I have a master's in adult health nursing and a minor in education. I'm going to be starting this fall to get my postmaster's in informatics. There's a lot of stressful situations you will. Sometimes you can get stress from patients. Sometimes you can get stress from even your coworkers. So from a patient standpoint, your patients will stress you out. Sometimes they will be constantly asking you different things. They'll be demanding patients. There'll be patients that are very difficult. So you have to learn how to manage them. And you have to learn how to manage your own anger and your own frustration. Sometimes when you or I feel that it's getting to a point where I can no longer deal with this particular patient, I have to take a step back and realize the patient doesn't have a choice of being in the hospital. I'm here to take care of them. So you just take a few minutes, you step out, and that goes for all nurses. You step outside of the patient's room, you step out of the unit. That means either you step off the floor, take a little break, and just pull yourself back together and realize that this isn't about you, that you have to take your emotions out of it, and that you're there to serve the patient. You don't bring in your personal business, your own issues, whatever problems you have at home or at work. They don't matter because you have to take care of the patient. For me, I like to deal with my own stress sometimes on my own way. As I said, like I'll step off the unit or just pull myself back together. But for every people, and sometimes they do it too, your coworkers, your fellow nurses are your punching bag, so to say. It means they're there to listen to you and you talk about your frustrations. This is the one of those things you share with your coworkers, your frustration with your patients, because no one else but them can understand what you're going through. And when you talk it out, this is how my coworkers deal with it sometimes. They talk to us. No matter how busy we are, or no matter how hard our day is, sometimes you have to listen to your coworker because you know what? They need you. So you're actually nursing your own coworkers sometimes because letting them talk out their frustrations is a form of them, their own form of therapy. So that's how they deal with it. You have to be able to talk to one another. You have to develop that kind of communication with your coworkers. Okay, so again, from what I said is talking to your coworkers is a form of therapy. It's how you get off all that stress and, dealing with all of the frustration you deal with all your patients and being a nurse. So when you drink, and we as nurses really do tend to we drink on a social basis because you'll note that after work some of us will go to a bar and drink. It's not that we're addicted, it's that it is that it's from a sociological standpoint. That sociology was that form of interaction, the social experience and the whole process of, sitting together, having a few drinks and talking about things, about your issues, about various things is part of life, part of how we as individuals, not just nurses, deal with certain things. So it's not to say that we are addicted, but if you're asking the point of how do we prevent ourselves from being addicted, one is just, first you have to know your own limits, and two, you have to know that there have been many cases where nurses who have drank too much and they ended up drinking and driving. They could have potentially have lost their licenses because you as a nurse, even if you're off duty, still have to represent what the best kind of person has to be. That means you shouldn't be ending up like your patient who's an alcoholic. You have to be a role model in that particular standpoint. You have to be a model and set the example that it's okay to drink socially, but you have to know your limits. And, alcoholism is a disease, and you can easily get addicted to, and that's why, you have to know your limits again. Go ahead and finish that. Okay, so from my own personal observations, I think some of the biggest health issues that nurses face on a chronic daily basis, besides getting an infection from a patient, or getting a needle stick or something like that or another. It's your diet, which involves also maintaining hydration, and also exercise. I find that a lot of nurses do a lot of stress eating at work, and it's not because, maybe it's in part because of how they cope with their their day, but it's also part of just how nursing workflow goes. Some days you don't even have a chance to even sit down and eat a full proper lunch for an hour, and I'm not saying it's a good thing, but it's also the sacrifice we as nurses make, that instead of taking the full hour of our break and eating something healthy, we'd rather be taking care of our patients or documenting what we did, which is perfectly okay. But I think that's a big problem in nursing, that we tend to eat at irregular hours. It's never consistent on a daily basis. And sometimes we'll eat whatever is convenient, sometimes something very fast and unfortunately very unhealthy. So I find that what I've done is I pack little snacks of like little carrots and sandwiches, and even if it's to take 5 minutes to drink some water or eat like a few carrots, it is something. Because if you can't take a full break to eat a full meal, you might as well, which is the way nutrition is from what I've heard, it's better that you do 4 small meals throughout the day instead of 1 or 2 big meals. So you spread out your meals, or you spread out your snacks. So that means you have to really think about nutritional options, and you also have to stay hydrated. Because nurses like to drink coffee. And as you know, coffee is a diuretic, so it'll make you pee. And 2, they're most likely not replacing it because they're not hydrating. So to stay healthy in a personal standpoint, always try to think of a nutritious meal and try to bring in something that is nutritious, hydrate, and exercise. Because exercise honestly helps you deal with that stress. You'll find you have more energy because you're running on your feet 12 hours a day, and you'll be exhausted at the end of the day, but you need exercise even still when you're off work. So one of the first advice I got as a nursing student, was the following thing. When you're working as a nurse, you just gotta do things. 1, when you take care of yourself, protect yourself, then protect the patient, then protect the hospital. That means if you can't protect yourself, that means if you don't have the knowledge to take care of that patient or do the procedure, you don't have the necessary equipment, you don't have the gloves, you didn't ask the question about this particular medication, about why we're giving it, that's how you protect yourself. Meaning you need to know and be aware of your thing. 2, protect the patient. That means after you've done protecting yourself with the knowledge that you need and making sure you have everything you need, you protect the patient. That means you're looking out for your patient. That means you're doing your assessments. That means you're following up your blood pressure after you give your medications. If you don't know something, you're answering this protect your patient. And that's what that means. And following that, if you protect yourself, you protect the patient, then you protect the hospital. And that's all you're required to do. That's the gist of of being a nurse at a hospital is. You protect yourself because that is a priority, because if you can't protect yourself, you can't protect the patient. If you can't protect yourself and you can't protect the patient, you can't protect the hospital. And that's it.
All right. Thanks, Sean.